Namaskar, good evening everyone. Thank you for making the trouble to come all this way. Thank you Anirban, thank you Shakti for putting this forum together. Let me start out by giving a little bit of a deep dive into the budget because I think my fellow panelists have done a stellar job of laying out the framework and talking about the basic macro in terms of intent as well as the pledge in terms of what the priorities of the government are. On the point that Bibek and Ratan both alluded to, which is the budget is made out to be a bigger issue in India than, frankly, it is made out in most other countries. Well, that is true. In fact, we make a much bigger deal of the budget than I have personally seen elsewhere, but there's something deep about that, and that is that it is really a reflection of how our economy is organized. The government sector is still a very large player in the economy and different sectors of the economy. Therefore, signals that the budget gives out through these budget statements also have repercussions on how those sectors respond. All right? And of course, the idea is that over long term, with all these economic reforms that are being attempted and the structural reforms that have been put into place over the last 3 years, the idea is that budget in the long term should become a non-event, should become a predictable event, unless of course we are making a tectonic shift in terms of thinking of something grand. So budget should become predictable, but budget should become insignificant, and frankly, that is the objective of large economic reforms attempted within the government. But you have to realize that 70 years of work takes a lot more work to undo a lot of these rigidities that have been introduced into our markets. So then let me then get to the second aspect, which is the deep dive that I spoke about. This budget is really one of continuity. What you have been hearing over the last 3 years, we are hearing more of that, and that's exactly how it should be. The emphasis on infrastructure. India's high growth, India is the fastest growing economy today, and a large part of that has to do with government spending. And what is that government spending geared towards? Well, essentially infrastructure. And that is exactly where money should be spent at this stage of growth of any economy. So infrastructure investments, spending on infrastructure, there's a large continuity that we have seen in this budget if you compare it with the last 3 budgets. All right? But other than the hard infrastructure, when we talk about railways and roadways and air traffic and waterways, and of course there's the broadband, so it's infrastructure in hard sense. There is also a second aspect of infrastructure, which is what often in India gets clubbed under the social sector. Okay? And I think we do a great disservice by clubbing health and education, which are essentially human capital. Human capital in India is that complementary input which is going to trigger the phase, the next phase, the future phase of the country's growth. So we have to make enormous investments into both these kinds of human capital, education and health, to really realize the promise of higher productivity and higher growth. We are fast growing, but remember the level, we are still a relatively poor country. Our aspirations are very high, but to get to that, we need sustained high growth for next couple of decades. And that is going to take a lot of effort. So many times, the reforms that are happening within governance, for instance, should be understood from that standpoint, okay, that growth path that we are trying to attain. So now the 2 aspects of human capital, health and education. This budget again has been one of continuity. Now in the healthcare space, which is something that I have been writing about a great deal in the last 3 years, healthcare space requires a lot of restructuring in India. For instance, let me give you a sense that, we compare, often in India, people tend to compare Indian markets with the US market because, these are fiscal federal structures, large plural democracies and so on. So obvious comparisons are there. The US spends 18% of its GDP on healthcare, okay? And it has more or less the same health outcomes as Singapore, which spends under 4%. What it tells you is the way you finance your healthcare is very important, is very critical to determining those health outcomes. All right? Now, So financing is one aspect of it, but healthcare really has to do with access and affordability and quality. Those are the three aspects of healthcare that we have to try and change. So in terms of access, people are getting richer. So over the last, let's say, 20 years that we've had growth, income levels have increased and people are seeking more and more healthcare, which is a good thing. But you know, in the normal life cycle of any disease or life cycle of healthcare, we need a lot of gatekeeping at the early stage. We can't be running to hospitals for cold and cough and simple viral and so on, which is what we are doing today. Because in many ways our primary and early secondary is largely broken. And that has happened again because of 60 years of neglect or whatever you call it. But strengthening that primary and preventive care has to become a priority, and this budget has signaled the creation of the wellness centers. Now, do you know we have population benchmarks? Every 5,000 people in the population, we have one sub-center. That sub-center is basically getting transformed into a wellness center. So wellness center is going to cater to a lot more needs than what the current sub-centers are. So we need more resources. Why is this gatekeeping important? Because we want to capture most of our ailments at that level. In fact, a good nurse is capable of doing a lot more than, a doctor at that stage, early stage of healthcare requirement. And that's the direction in which we are moving. So if you take care of the access, which is strengthening the primary care through the wellness center, the second aspect is affordability. In this country, despite now we've had over the last 15 years or so, several publicly financed health insurance schemes. In fact, even before Rashtriya Swasthya Bima Yojana happened through the central government, many states like Andhra Pradesh, Karnataka, Tamil Nadu, they have had their own state health insurance schemes, okay, of different coverage, different kinds. And they have all been experimenting. So there's a lot to be learned from where are the loopholes, where does the fraud happen. They've all been experimenting with IT systems. So how do you capture some of this fraud and so on. So we have experiments to learn from, which is what is being used in terms of strengthening and defragmenting the market, frankly. We have states, and then we have RSBY, which was launched everywhere in 2008. The National Health Protection Scheme, the large scheme, what is now popularly being termed as Modi Care, is really an attempt to defragment the market and bring all of these things under one umbrella. Okay, so this is a great move. Now, the money set aside for it, often people will argue it's too little, and that's what you keep hearing in the media. And this, my fellow panelists will also attest to, frankly, allocating budget for something is perhaps the easiest thing to do in the scheme of things, because what we are trying to attempt is a large governance change. The absorptive capacity within the government is very limited right now, particularly in the health space. So which of you in this room would believe that if we double the health budget of Uttar Pradesh, our health outcomes will double for Uttar Pradesh? And the reason I say Uttar Pradesh is because if we can improve the health indices of Uttar Pradesh, all India average will go up significantly. Okay? So you do realize it's not a budgetary problem alone. So allocating resources, frankly, have to be in sync with what the absorptive or the capacity of the government is to absorb these funds. So we really are taking one step at a time. Now that is the tertiary care aspect of it, which is the affordability. Do you know that 7% of Indians fall below poverty line because of healthcare? And that number has stayed the same in the last 10 years. Despite so much growth, despite government, expanding health insurance schemes at the state and so on. So now there is a lot of lesson to be learned. So of course the coverage has been increased. We've never had 5 lakh coverage for poor households ever in this country. So in that sense, it is a huge experiment that we have attempted, but if all goes well, this will prove to be a game changer. All right? The last aspect, so we looked at access, we looked at affordability. The third aspect is quality of care. Our NSS data, our NFHS data, they all tell us that the reason people don't go to public healthcare system, infrastructure, is quality. Now, quality is like a composite metric. Many things come under that. That wait time is long, the doctors are not there, the medicines are not there, so on and so forth. So many things come under quality. Now, for the first time, we are trying to measure quality. And this is not just an Indian problem, frankly. Quality of care is that cutting edge of medical research being carried out even in the OECD countries. Quality of care is a very difficult thing to measure. But now we are sort of standing on the shoulders of giants. There's a lot of literature that has been generated. We are using some sophisticated metrics and trying to come up with quality measurements for our district hospitals. So we start with the district hospitals, but you will also realize and appreciate that from there, the next phase of reform, or in some sense focus, has to be towards the private tertiary care. Because 75% of Indian OPD and 55% of inpatient is exclusively private. So India still largely depends on private healthcare for its needs. And so we have to look at quality of care there. And often we keep hearing about cases that the media throws up, but systematically it has to be taken into consideration. So that's as far as healthcare is concerned. In this budget, the announcement in terms of education were twofold. One was at the school level, where now the RTE is being extended to grade 12 all the way. It is no longer only primary, and that's a very big change. The second is, for the first time, we have actually put aside 1 lakh crore for research and development and teacher training. We have had a very large increase in terms of engineering colleges in the south particularly. As far as the intention of the central government is concerned, every budget we do announce the opening of IITs and All India Institute of Medical Sciences, AIIMS, across the country, because you have to move out of Delhi. Okay? Delhi still caters to almost 40% of total tertiary care in the country. That's too much. So we have to move institutions and centers of excellence and care away from Delhi and from urban areas and so on. But that announcement, while it is very well intentioned, the constraint there is again not resources. It is not a real estate business. The constraint there is faculty. If you don't have good faculty in your AIIMS and your IITs, despite the brand, it is not going to be an institution of choice for our kids. So this teacher training program, this 1 lakh crore which has been set aside for research and development within the university system, is a very significant announcement. Because the idea is now there is emphasis on creation of a pipeline of educators, because you need PhD program to actually have faculty. And of course, we have the PhD program, but there the resources are a constraint. We also systematically are trying to make these institutions, we have centers of excellence, institutions of excellence, eminence being announced. All of these are effort towards exactly that direction. Now, those were the two social sector, health and education capital, human capital that I wanted to focus on. Very quickly, the one thing on gender is, I'm glad this budget did not put out a token item in the form of budget, gender budget. While gender budgeting is a different component, we didn't have set aside money for one ministry which caters to the needs of women. Because you have programs, whether it is the LPG program, whether it is the household lighting program, a lot of it disproportionately benefits the female population of this country. And these are things to be lauded in great extent. Now, there are many other aspects of the budget that I'm happy to answer questions on, but maybe we can leave it for the Q&A section. Thank you.